And now let's begin our first session of the day, Decarbonizing the Healthcare Sector from Vision to Reality. The healthcare sector has a critical role to play in mitigating climate change by reducing its own emissions to net zero. Today, our speakers will share insights and strategies to move from the vision of a decarbonized health sector to making it a reality. Before we get started, a quick reminder, you can submit your questions in the chat throughout the session. We will have a Q&A at the end to address as many of them as possible. Let's begin. Our first speaker is from the House, Andreas Ekvall, Senior Climate Officer at Healthcare Without Harm, Europe. You will present now, and as explained by Mark Wilson, our mission is to transform healthcare, and an integral component is to be in the forefront and build capacity in health systems. Andreas, you are welcome to the stage to present the strategies and frameworks developed to enable a net zero European healthcare sector. Andreas, we can see your presentation, so please go ahead when you're ready.
Thank you, Maria, and thank you for giving me the opportunity to present. Today, I'm joining you to present Healthcare Without Harm's work on methodologies, papers, and strategies assisting health systems to reach net zero healthcare. I am a Senior Climate Officer at Healthcare Without Harm Europe. In September 2019, Healthcare Without Harm and Europe published Green Paper 1, Healthcare's Climate Footprint. The paper puts healthcare in the forefront of sectors that need to be decarbonized, because healthcare's carbon footprint was equivalent to 4.4% of global net greenhouse gas emissions and 4.7% of the emissions in the European Union. If healthcare was a country, it would be the fifth largest emitter. While the emissions vastly differ in scale between each nation's health sector, the lion's share of emissions can be attributed to the global supply chain, or Scope 3. This is a call for action and collaboration between health facilities and health systems, but also with suppliers and manufacturers working in the health sector. In the latest carbon footprint by The Lancet, the healthcare sector represented 4.6% of all greenhouse gas emissions. These carbon footprints confirm the pivotal role of the healthcare sector in achieving decarbonization, and that the healthcare sector must act to achieve emission reductions aligned with the Paris Agreement. In April 2021, Healthcare Without Harm and Europe published Green Paper 2, the Global Roadmap for Healthcare Decarbonisation. Green Paper 1, or the Healthcare's Climate Footprint, quantified the emissions from the healthcare sector. With Green Paper 2, Healthcare Without Harm sought to describe scenarios of future emissions and pathways, as well as actions that could reduce emissions. The paper confirmed that without actions, the emissions from healthcare could triple by 2050. The paper also asserted that the commitments made by world governments to reduce emissions would lead to an increase beyond the current footprint, and that the healthcare sector will not reach emissions aligned with the Paris Agreement without further action. However, the paper also confirmed that decarbonisation is possible. The paper includes several high-level actions that can close the gap and reduce the carbon footprint. But to achieve the reduction of emissions, all health systems are required to act based on their capability and historical responsibility. To create a path aligned with the Paris Agreement, every healthcare institution must act together, both with suppliers and manufacturers in every country. We know the carbon footprint and actions that could reduce the emissions of the healthcare sector on a global scale, but to encourage and enable all health systems to act, it is necessary for an in-depth understanding of the emissions in each health system. To enable health systems, Healthcare Without Harm and Europe developed the methodology Designing a Net Zero Roadmap for Healthcare in July 2022. Operation Zero is a Healthcare Without Harm program that uses the methodology. with the vision that every European country adopts a national decarbonisation plan for its healthcare sector that is compatible with net zero. As of today, Healthcare Without Harm has partnered with several health systems that have started their Operation Zero journey. And every year we aim to partner with more health systems to produce the most comprehensive overview of the European health sector's carbon footprint. The partners will quantify their carbon footprint, engage with stakeholders, set carbon reduction targets, and identify carbon reduction actions. The program was fundamentally designed to enable every partner and country in Europe to develop a decarbonisation roadmap that will align the emissions of the healthcare sector with net zero and the Paris Agreement. Today, we are joined by experts from both national, regional and local health systems who will tell us how they are navigating the course to net zero emissions. We recognise that everyone in the health sector needs to act, and I hope that the vision of Operation Zero and the diligent work of the speakers inspires continued actions to decarbonise the health sector. Thank you for listening to this presentation on the road to net zero healthcare.
Thank you, Andreas, for setting the scene. This was actually a great introduction to our next presentation, which is about putting this into practice. So I would like to welcome to the stage our next speaker. Bram Lefebvre works for the Belgian Federal Ministry of Public Health, Food Chain Safety and Environment and coordinates the Belgian National Environment Health Action Plan. Bram will present the work of Belgium in calculating the emission baseline from the Belgian health sector and share the targets and plans for the future to develop a roadmap for decarbonization. Bram, all yours.
Thank you for the kind introduction, Maria. So, the origins of our study that we have conducted into the greenhouse gas emissions in the Belgium healthcare sector is linked to the COP26 of the International Panel on Climate Change. For those people who are not aware, that's basically the yearly climate summit. And the COP26 that was in 2021, there Belgium, just like 60 other nations, committed itself to building a climate resilient, but also carbon neutral healthcare system. Now, in the wake of this this climate summit, we set up a national working group where in the framework of the National Environment Health Action Plan for which I work. And so this was really important because Belgium has quite a complicated policy landscape with environment, climate, health competences being shared between the regional and the federal level. And so this national working group brought all the competent actors together. And so the first order of business of this working group was, what are the emissions in Belgium? Because we don't know that. And so that's where we started a project with Healthcare Without Harm and Arab to see exactly what are our emissions, how can we curb those emissions, because first got to know where they come from. And this summer we finished the first part of the study, which is how much emissions are there in the healthcare sector. But before we dive into the results, please take into account that these are often rough estimates because we had a lot of data gaps, which we had to plug with estimates, because for a lot of the a lot of data we simply don't collect in Belgium on a federal level, on a regional level. So just kind reminder, take it with a grain of salt. So maybe that's less important, but Belgium emits about 10,000 kilotons of CO2 or carbon dioxide equivalents of emissions, or at least its healthcare sector. And so just as in other similar researches, this is always divided into three scopes. Scope 1 being emission sources that are directly controlled by the healthcare sector, and scope 2 and 3 those are emissions that are not directly controlled or owned by the healthcare sector. Good example of scope 3, for instance, or scope 2 would be the purchase of electricity, because obviously that's not directly controlled by the healthcare sector. So what we immediately see here, and Mark already referred to it as well, is that 86% of the emissions of the Belgian healthcare sector come from its supply chain. So the supply chain will be the challenge ahead. And so if we dive deeper into the supply chain, we see that pharmaceuticals take a huge chunk of that emissions, followed by business services, medical equipment, and also to a lesser amount, food is also a bigger contributor in the supply chain. Now, in this research, we have divided the whole healthcare sector, because that's pretty big, into 7 different subsectors. And as we can clearly see on this slide, is that hospitals are by and large the biggest emitters of greenhouse gas emissions. Another interesting result that we saw is that if you look at all the subsectors, hospitals, residential long-term care facilities, providers of ambulatory care, providers of ancillary care, or ancillary services, retailers of medical goods, providers of preventative care, providers of healthcare system administration and financing. If you look at all of these, they have very different let's say divisions of sector of scope 1 to 3. Like every subsector of the healthcare system has a different profile, so to say, of the scope 1 to 3. What's very interesting is, as I said, hospitals are by and large the biggest emitters, but 90% of their emission, or it derives 90% of its emission from the supply chain, as you can see here on the upper left graph. Almost 90% of it is the supply chain. And so I would say these are the most interesting findings we have from our report. So we're still working on it. So what are the next steps is that now we kind of finalized this baseline study that explains us where the emissions are coming from, is what are we going to do next? So we're going to make a roadmap together with Healthcare Without Harm and Arup into a roadmap of how to decarbonize this healthcare sector. And normally this report should be finished somewhere in November. And when it's finished, we will publish it. And we will use that as a leverage to start discussions with the political level and with the field in itself, as this was very much a top-down research. We used a lot of national, regional data, but we haven't spoken a lot with the field itself. So these are very clearly the next steps. And I guess you will hear more of it once it's published. If you have any questions on this, just write me and I'll be happy to answer them.
Thanks, Bram, for sharing with us your journey. And we would love to hear everything about it, actually. So we will stay, of course, tuned. And I will now give the floor to our next speaker, actually. Our next speaker is Carolina Pettersson from the Region of Stockholm, where they have been working on decarbonizing healthcare at a regional level. Carolina will share strategies and lessons learned from this ambitious initiative. Thank you, Carolina. The floor is yours, and we can see your slides. Thanks.
Thank you, and good morning. In the beginning of the 19th, Region of Stockholm in Sweden launched its first environmental program. So if you fast forward some 30 years, we have significant results to be proud of, even though we have not yet reached our end destination. How do we get almost 48,000 employees to ingrain sustainability in everyday work and everyday decisions? How do we manage sustainable change? As you said, my name is Carolina Petersen. I'm the Director of Sustainability in the Region of Stockholm in Sweden. And my mission here today is to give you a snapshot of our goals, on our steps on the way to lower our emissions, and how we put sustainability strategy into practice. And also, of course, our lessons learned. And later on, a colleague of mine from the Karolinska University Hospital will present a fantastic work and more concrete examples on their work more on a local level. But first, let's take a quick look at the Stockholm region. It's a small geographical part of Sweden, but the largest of Sweden's 21 regions with 2.4 million inhabitants. We stand for 1/3 of the Swedish GDP, and we are responsible for public transport and providing healthcare to our inhabitants. Our budget totals 120 billion Swedish crowns, and that's about 12 billion euro. Our investment schedule for the next 10 years comprises of a total 12 billion euro, and 20% of that investment budget is in the healthcare sector. Our sustainability journey has been going on for a long time, and you can see here on the timeline here. In the beginning of the 90s, as I mentioned, we had our first environmental program, and we have been working successfully ever since. Various of documents, steering documents, have been added: equality policy, LGBT policy, environmental certification, ISO, and so on. But all of these steering documents have now been integrated in a unified management system to facilitate priorities. No more governing documents in silos. And we have 2 goals, and if said together, Region Stockholm aims to be more ecological and sustainable, socially sustainable, and climate neutral by 2035. Our history tells us that we can succeed in reaching our goals. As you can see here, we have reduced our carbon emissions by 75% since 1990. And compared to 2019, we have lowered our emissions by 20%. So it's a new baseline. But this is mainly Scope 1 and parts of Scope 2 and 3. So working systematically with Scope 3 emissions, it's new for us, like working with the supply chain emissions, even though we have good examples of working with that, of course, but not measuring it like this. Last year, we did a carbon dioxide budget on our own organization. So not just a territorial one on our geographical area. So we did it on our organization and per organization within our company, within Region Stockholm, within our group. So for each hospital and so on. The carbon dioxide budget sets the rate of reduction for our emissions. It considers how much reduction is needed in the world, and then the pace and the space that we have and that we have to have, the reduction pace we have to have in front of us. And in this work, it became clear that the emissions that we have worked with before, like Scope 1 mostly, but also Scope 2, we can handle them in the next coming years. And that it is time for us to start focusing on the systematical work with Scope 3 emissions, with the supply chains and so on. This is also our carbon, a picture of the work with our carbon dioxide budget. And if you lean forward, you can see a thin blue line here on the bottom of the graph. And that's our scope 1 and 2 emissions in Region Stockholm, so our entire emissions. You can barely see it. So the green color area here is our scope 3 emissions, our consumption-based emissions from the healthcare sector. And this is not exact data, as you who works with this. So it's unsure data, but still you can see the big differences here. Our budget says that our emissions have to decrease by an average by 8% per year to achieve net zero in 2035. So our journey towards our new goal, climate neutral, has started. Sustainability transformation requires change in decision-making processes, changing practices, change the way of working. And as you know, change are not easy. We have stumbled, we have failed, we have succeeded, and we have learned plenty. And let's have a quick look at some of our most important lessons that we learned. We have set up sustainability dialogues with each board for each organization within the Region Stockholm. It's almost 20. The agenda on these dialogues is our sustainability journey, our goals, a SWOT analysis on their work, and a discussion and dialogue on what's the recommendations forward and what's the priorities. We have done these dialogues for about 1.5 years now, and we no longer need to speak about why this is important. So it was a lot of focus on that in our first meetings. But now the boards are more eager to discuss what shall we prioritize and why and how. To have sustainability integrated in the management system demands more of each group and more of each CEO. They need to decide what their priorities are and how they should reach their goals. This year, we work with a new climate action plan, a plan on how to be climate neutral in 2035. It's not yet decided, but on its way. And this climate action plan will help us in what direction each organization should work, but they still have to break it down in own actions. We have moved from having separate environmental program to integrated sustainability into overarching management system. This means integrated in our goals, in our indicators, in our management, and in our following up on a group level. And as I said, this has been a giant leap to do this change, more complex than we thought. So we have done a great effort to communicate this in all kinds of ways and also support as much as we can. At the same time as we worked with our carbon dioxide budget, our new goal of being climate neutral by 2035, same as net zero, we realized that our organization didn't speak the same language as other companies or other municipalities in Sweden or Europe for that. When we showed the results of the carbon dioxide budget to our politicians, they instantly said, we must include Scope 3 in our goals. And so they did. But as we started to work with our climate action plan, we talking to the different organizations and companies and experts within the Region of Stockholm, it became clear that net zero is extremely difficult to reach so fast. It's quite obvious, but still, and that we're not going to reach all down to zero, regarding our responsibilities as an important public actor. So now it's more fair to say that our goal is to reach near zero, as near as we can. And maybe 2035 is not a realistic goal for our Scope 3 emissions, but still we're going there in that direction. And we don't want to get stuck in terminology and meaning. We want action, of course. And of course, we also need to sort out the uncertainties linked to our Scope 3 data. In our climate action plan work, it also became clear that we have to move away from overconsumption. Overconsumption is a problem in society in general, and therefore the healthcare sector is no exception. So we must stop the overconsumption of care and material, choosing wisely when it comes to tests, treatments, and procedures, and what we procure, store, and have in pipeline. So getting away from just in case. So this is also something that we have to speak about in the healthcare sector and its professionals. We started our journey by focusing on changing the system. We have relied on the environmental management system and the environmental program. And as we integrated it on the ordinary system, we hope that that will be enough. But we quickly realized that change management doesn't happen without changed leadership. So the next steps on our journey is focusing on change leadership and what to prioritize, and make sure that the CEOs and the boards make sustainability as part of their strategy and everyday decisions. All our CEOs within the Region of Stockholm shall be in the front line. Our top manager is indeed, and our politicians leading the way. Finally, we must, as you all know, ingrain sustainability in our everyday decisions, practices, and ways of working. I always say that I want to be out of work. It will be a great sign of success for sustainability undertaken in the Region of Stockholm. Everyone being sustainable, acting sustainable. Thank you.
Thank you so much, Carolina, for sharing those regional level strategies and how the Stockholm region is tackling this issue, and for sharing these last words, powerful words, with the audience. Now, I would like to welcome to the stage Oliver Slaughter of the Sussex Community Energies Foundation Trust. Oliver will speak about the decarbonization strategies being implemented within the trust, and will share insights into how healthcare facilities can achieve meaningful reductions in their carbon footprint. Oliver, the floor is yours. Thanks.
Thanks, Maria. And thanks, everybody, for the opportunity to come and speak with you today. I'm really looking forward to sharing with you what we're doing in Care Without Carbon, and how we are changing that from vision to reality. So just wanted to talk you through a bit about the vision. So Care Without Carbon is really the vision. It's the framework in which we are delivering sustainable healthcare within Sussex in the UK. And it was really dreamed up by a few people within the organisation about 10 years ago now. So and really that goal is very similar to Healthcare Without Harm's objective. It's how do we deliver healthcare without the pollution, and how do we deliver healthcare that is not creating the need for healthcare elsewhere. So we, as I said, we sort of started within Sussex Community. It's a healthcare organisation within the UK that delivers healthcare mostly to people in their homes. And over the years, we've now expanded that into a larger team, into a team of almost nearly 15 now. There's a picture of the team on the slide there. And we're now working with about 7 healthcare providers across the southeast, both in Sussex and in Surrey, the other county in the southeast of the UK. And really, excuse me, really that started with a commitment to carbon neutrality. Any vision is no good unless you have a commitment and a direction and a drive to back that up. So we started that with a commitment to carbon neutrality, but now I'm pleased to say that's evolved into a commitment to net zero. I'm just going to talk a bit more about that commitment and what that involves. So really, that commitment is led by our national NHS. So we're really thankful and excited that our National Health Service came out with a very strong ambition to reach net zero. So they published that in 2022, and that's been massively helpful for our work and getting organisations that we work with to commit to net zero as well. So really, that sets out by 2040 to achieve net zero greenhouse gas pollution for all of our direct pollution sources. And by 2045, giving us that little bit more time for our indirect emission sources that we know are very challenging and are hard to quantify. So 2019, 2020 is our baseline year that we're working against for that. Not necessarily sort of nationally mandated, but we feel very important for us is to have these 5-year interim targets to check that we're on track, to check we're in progress and we're making good work towards our objectives. So, but the work that we're doing as well, we're trying to expand that commitment beyond just net zero. We're trying to make sure that we're including other aspects that are really important to the work that we do. So we, in 2022, we also commissioned a piece of work to look at the impact of climate change across Sussex for both our population. So how are the impacts of heat waves, for example, going to start affecting our patients and our communities? But also how is the impact of flooding, for instance, going to impact our health centres? So climate adaptation is really important for us, and the work here is slow. It's difficult to juggle against the day job of trying to mitigate pollution, but it's really important that we keep these areas and keep working away at adaptation. And the other area is aspects of the Environment Bill, which is now the Environment Act, which is a piece of UK legislation which has a raft of different protections for the environment. But within that, I think the one that's most interesting to pull out there is biodiversity. And nature often gets very forgotten. We often get very caught up, very sort of tunnel focused when we're working on net zero. But it's really important to note that we need nature. And I think a lot of you know this, we need nature. And we need it as much as we need electric cars and we need heat pumps. So that is something I wish we were further ahead on. But it's really something in our sights, and it's something that we are slowly building more and more into the commitments of the work that we do. So all of this work, our green plans, which I'll show you in a second, they are due to be refreshed next year. So we'll be updating our targets, we'll be setting our sights on 2030 and working out what do we need to do to deliver against that. So in terms of the different green plans, we've been privileged being able to write green plans for a number of organisations now using the Care Without Carbon framework and our approach. And really that's now all feeding into a sort of more of a regional approach for Sussex. So within those, they've all got their own targets, they've all got their own actions and aims, but all under that umbrella of net zero. And there's a variety of different healthcare organisations within that. There's acute hospitals delivering surgery and emergency care. There's mental health hospitals, and there's also community, as I mentioned, delivering healthcare to people in patients in their homes. And we're also expanding that work outside of different organisations outside of the region and collaborating to deliver on our commitment. So what is the Care Without Carbon framework? I sort of mentioned that already. It's probably not enough time to take you all the way through it, but I just want to talk about one of the core pieces here in this graphic, which is our sustainable healthcare principles. So this is really setting out how do we approach most of the issues that we come across? How do we approach a lot of the care that we're trying to change? And really, that'll be quite familiar to a lot of you, I hope, which will be the first one here is healthier lives. So that's really around prevention. That's how do we prevent people getting ill in the first place. From a sustainability perspective, if people aren't coming through the door of the hospital, that is a fantastic thing for us. The next one is streamlined processes and pathways. So this one is very much about taking a quality improvement approach to healthcare. How do we reduce duplication? How do we avoid doing the same blood test twice, for example, or the same patient coming to a similar appointment again? So how do we reduce the duplication and waste and effort within our organisation? And then the third one is, if we do have to provide that care, if we have to provide healthcare, how do we do that using the most sustainable resources, the most sustainable equipment, the most sustainable buildings and infrastructure? And those are really the sort of driving principles around how we approach a lot of the challenges and a lot of the work that we do, and helps us sort of work towards our overall vision as well. Then within that, we start to split our work down into different work streams and work areas. And I've already talked about the team, but I'm very proud of the team that we work with. And to be able to sort of work on this regional level, to be able to work with lots of people across the region, we've been able to build a team that specialises in different areas. And I've listed a few of them here, but we keep finding that we need specialisms from different areas. So we've got specialists in our team on waste management, on sustainable transport, on greenhouse gas reporting, on data and analytics. And actually, what's really exciting is we're starting to bring people into the team using this regional approach. We're starting to bring people in the team that have clinical expertise. So we now have a qualified doctor in our team, someone from sort of pediatrics experience. We now have a dietitian that's temporarily on our team. So we're very excited to be building the team and building those specialisms within the team as well. And that regional model has allowed us to do that and to focus our work. So how are we doing? As I mentioned, we deliver sustainable healthcare for lots of different organisations, but as I'm sure a lot of you can relate to, staying on track is challenging, is hard. It was hard for us because last year was the first year that we breached our pollution limit, we breached our sort of target line, and now the real focus is how do we come together, how do we get back on track, and how do we make sure that we can continue to get back on our target line. And finding that balance between reporting and delivery is one that we struggle with quite a lot. But I just want to talk about those challenges and what do they mean in terms of how we're approaching our work, and what are the core challenges that are facing our delivery and making sure that we can hit our targets and stay on that ambitious trajectory and timeline. So three of those, I've come up with three of those to talk to you about today. The first one is time. I'm sure a lot of you can relate to this, is not having enough time in the day. not having enough, even with a team of 15, there's not enough time in the day to do and deliver all the things that we need to do. The next one is integrating into clinical practice. So how do we get our clinical colleagues on board and supporting the delivery of this, and building it into the day-to-day delivery of healthcare. And then the third one is, no surprise, it's money. So how do we get the funding? How do we get the capital and the revenue funding to deliver what we need to deliver? And so I just want to talk about how we've approached some of these issues as well, which have helped us. They haven't resolved the problem, but they've definitely helped us on our way. So time, we undertook sort of some prioritization work. We developed a methodology. So we looked at all of our actions that we had and the work that we had, and we sort of set out a way of prioritizing our work. So we evaluated sort of each of our actions and objectives based on what's their environmental impact? How are they contributing to net zero? Do they help support climate adaptation? Do they help support biodiversity restoration? But also some other things that weren't immediately obvious when we started looking at this. So is this related to the organisation's reputation if we don't do anything around this area? Is it really good for hearts and minds? We know how much people love recycling. And as much as we know recycling isn't necessarily the biggest environmental impact, people really engage with it, and it's really important to them. So is that a good way of getting people on board and getting people engaged? So we evaluated our work across some of those different elements that wouldn't always immediately be obvious, and we use that to prioritize our work and make sure that we're focusing on the right things at any one time. The other thing is a bit of a conundrum, really. It's data. So there's lots of different ways we collect data, and data can be a time sap. It can take a lot of time, but also it can be really useful to make sure you're focusing on the right things. So what I would say is, how do you get data to work for you? How do you get data to be more automated, more easier to load and utilize, easier to analyze? So we've really thought about this in the team. We've thought about our reporting, our flow of information, our reporting. We've thought about skills and specialisms within the team. So a lot of us have developed expertise in using systems, software like Microsoft Power BI. And also we are recruiting a data analyst into the role now, because we realise how important data is, and getting it to work for us is really critical in both in decision making, but also prioritisation. So my big takeaway is, how do you get data to work for you and not be a massive time lag in terms of reporting? And data can be really useful. The third one here is strategy and planning. So using both of those things, prioritization and data, you can start to pull that information together and get a real picture about what is it that you need to deliver to make sure that you can hit your objectives. So, we track our carbon quite closely. We've developed the expertise in the team to be able to sort of start to measure the environmental impact. A lot of the work that we do, whether that's medical gases, whether that's inhalers, and some of the more difficult things like food, some of the more sort of scope 3 and supply chain areas, like IT, we're trying to get our heads around now, so digital hardware. And using that information to then sort of put in a picture of, like, if we were to deliver this project to reduce pollution in this area, how much saving would that provide? So really, we've come up with the delivery plan of, if we do all these things, we know we're going to hit the target. And that's been quite time consuming, but really helpful to present back to the organizations that we work with to say, look, if we do these things, you can reach your target. And that's been really helpful in a couple of ways, in being really clear about what needs to be done, but also being really clear about having the conversations about whose responsibility is this, who is going to deliver this. So we can start to have more productive conversations with the organization about what is it that, what support do we need from the organisation, perhaps from clinical teams, perhaps from different departments to achieve these objectives. But also what we've done here is we've looked at what are the opposite directions. So you can see on this slide that we have an increase in business mileage that's kind of working against us. So as we come out of the pandemic, we have a bounce back of emissions. So all those things are really helpful for us. The second one here is integrating beyond time. The second one is integrating into core business. So we're trying really hard to make sure we can integrate our work into clinical practice. One of the ways in which we're doing that is we're coming up with this green impact tool. So this is at business case level, or even an idea, when you have an idea of a thing that you want to change. We've been working with our QI team to produce this green impact tool that takes people through those sustainable healthcare principles that I mentioned earlier. How does this project help prevention? How does this project help remove duplication and waste? And we're developing an online version of this tool as well, with a grant that we've received as well. So very excited to be taking this to the next level, and enabling more people to be able to use this to help their decision making. And then finally, the other area is money. So I just wanted to sort of talk about this in relation to how we're trying to get money to sort of work for us. So we have the net zero carbon Chailey, which is a building that we retrofitted, and we installed heat pumps at, and the cost of that was quite high. But the thing that we did there in the business case was that we made sure that our financial colleagues helped us with the scoring of that business case to include environmental and health benefits. And that, working with our finance colleagues, really helped us achieve what we needed to achieve in time. And recently we've applied that same approach to electric vehicle charging investment. So the takeaway from that, I would say, is work with your finance teams and find ways in producing your business cases in a way that adopt these environmental elements, because a lot of the time people in finance are more interested than we necessarily give them credit for. So that's it from me. Thanks for the opportunity to speak with you, and very excited to hear your questions later on.
Thank you, Oliver, for sharing those practical examples of how healthcare facilities can lead the change toward decarbonization. Now we will open the floor for questions, so I will invite all the speakers to the main stage. And I will select some of the questions because I see a lot of interaction in the chat, actually. So there are many questions. I also encourage the speakers to go back to the general chat and just reply to these questions during the day. And I will take first one for Carolina. So there is a question from Pedro Beltran saying, it's really interesting to hear about addressing overconsumption. How do you train healthcare professionals to take those decisions? And which is the governance structure, please? Many thanks and congratulations.
That was a very hard question. So how do we train the professionals? Yeah, I'm on a strategy level, so maybe my colleague here soon presenting will answer that question better than me. But it's about providing a good system for in being able to work with the sustainability and that as I mentioned, that the CEOs and the boards are demanding this kind of work. So that's one. And how do we
I believe we lost Carolina.
Professionals, I would say.
Okay,
so,
exactly. Thanks, Carolina. You were gone for a few seconds, but I think we got most of your answer, and you can always continue the discussion in the chat. We also got a question for Bram, and you replied already this question in the chat. It was about the inhalers and anesthesia, and if it falls under scope 1 or 3 in the Belgium case. You already replied this in the chat, but would you like to add something else, as I see that the discussion continues?
Yeah, sure. I was just actually writing a reply to someone else on linked to that. In general, I would just say one of the major limitations of our study is that a lot, as I said in the chat as well, our study, it's not a peer-reviewed academic study. It definitely has some severe limitations, but for us, its main purpose is really to see where are the big emission sources in our healthcare system, to know where can we take action, and also in general to see, yeah, where can we take action. And one of the interesting things is indeed that a lot, if it's 86% or 80 or 90 or 75%, it's less of importance what it is the actual number, but it's more important. We know that a lot comes from the supply chain, and that we should take action there. And as Ms. Josephine mentioned, indeed, is that there is a very great initiative in the UK on greening the public procurement and so on. So that's something that we really follow with interest. Although it won't be applicable because Belgium has a more decentralized healthcare system. But in general, to wrap up my answer, it is true that a lot of the emissions from Scope 3 are kind of black box, because we rely on estimates, because a lot of pharmaceutical companies either don't measure it or don't want to um, share those numbers if they've got them. So yeah, I think that's a big challenge.
Thanks, Bram. And just a reminder that in the next session, we will talk more about Scope 3. So stay also tuned for the coming session. The last question I will take is for Oliver. There is a question from Hallie Gore. Could you speak more to the NHS efforts to harmonize LCA methodology, especially any collaborative work with pharma or medical device companies?
This is a very difficult issue, as I'm sure a lot of people are struggling with. There's a lot going on in the national team, not so much that we have direct involvement with, but there is a national net zero supplier roadmap, which sets out objectives for the sort of national NHS team, and within that roadmap, one of them is a product level carbon footprint. We were actually having discussions the other day about with other colleagues across the UK about what is that going to look like? What do we need to make sure works? Because getting that kind of product level life cycle assessment as a requirement for all of our suppliers is a massive undertaking, and we need to make sure that that's aligned and that all of those look the same depending on who's producing them. So in terms of involvement, not a huge amount from ourselves directly with those companies, but we're always looking for, within Scope 3, we're always looking for how do we build out those areas in more detail, because at the moment we're just applying general factors based on spend to get a sense of what our carbon footprint is, or we're getting into more detail. So I think I mentioned food. So we've done a carbon footprint of our food by working with the Cool Food Pledge, and we're looking to do a carbon footprint of our IT hardware in more detail as well. So we're trying to pick off the areas as we go, and we're looking really to the national team to help us with some of those sort of more wider sweeping requirements for all of our suppliers.
Thanks, Oliver, for sharing this, and maybe in next summits we can hear more about this, how this work evolves. This completes the session. We went a bit over time, so we are ready now to start the next session. I would like to thank again our great speakers and